This presentation is to introduce the viewer to art therapy for trauma. It will discuss what trauma is and the symptoms, and how art therapy can help, starting with two simple techniques inspired by AIP and EMDR. Let's discuss first trauma and what it is. Trauma is an emotional response to a distressing or traumatic event that can have lasting adverse effects on a person's mental, physical, emotional, social, or spiritual well-being. It can be caused by a distressing event or series of events, such as a bad accident, abuse, violence, sexual, physical, emotional, or mental, combat, or a natural disaster. However, not everyone that experiences a distressing event will experience trauma, and this will be discussed later. Trauma can be either a physical or emotional distress, whereas physical trauma is a serious physical injury. Emotional trauma is an emotional response to a disturbing event or events or situation. Acute emotional trauma is the emotional response that occurs during or shortly after a single distressing event. Chronic emotional trauma is a long-term response resulting from prolonged or repeated distressing events that can span months or years. Complex emotional trauma is the emotional response associated with multiple different distressing events that may or may not be linked. Here are some types of major trauma and accumulating trauma. Major trauma can be one-off events or accumulating over time. Anyone of any age can experience trauma. However, just because a person experiences a distressing event does not mean they will experience trauma. When a traumatic event occurs, be it a car accident, a loved one's demise, or the end of a relationship, our brain can go into fight or flight mode. The brain's default response in any traumatic event changes to protect us from any danger, shutting down non-essential body and brain functions until the threat ceases. Neuroscience is complex. However, I will try to explain in brief how the brain works and how it is affected by trauma. On this diagram, we see the amygdala. This is part of the limbic brain, which is the oldest, most primitive part of our brain and takes care of our basic survival. The amygdala sits near several structures that carry information from your senses, such as sight, sound, and smell. We depend on the amygdala to warn us of impending danger and to activate the body's stress response, such as the fight or flight response. Vertically, your amygdala is nearly level with your eyes. If you touch your fingertip to the temple of your head, just above the joint where your jawbone connects to your skull, and point directly towards the temple on the opposite side of your head, you're pointing at your amygdala or very near it. It is nearly halfway between the center of your brain and the skull, more towards the center. The amygdala acts as a smoke alarm, which activates an instinctual response in the hippocampus. The hippocampus can respond in either two ways. In an active response, fighting for your life or by running away, or two, in a passive response, such as freezing, fawning, playing dead, and or dissociating. Now the orbitofrontal cortex is a prefrontal cortex region in the frontal lobes of the brain, which is involved in the cognitive process of decision making. The prefrontal cortex is the newest part of the brain and is our social engagement system, which involves facial expression, eye contact, language and communication. It tends to like being in control and where most of the energy is drawn from in a life-threatening situation. These changes to the brain function are not just neurological in nature, but also physical, as the volume and size of various parts of the brain get impacted, such as the memory gland after a traumatic event. As your amygdala sits near several structures that carry information from your senses, especially smell, which is why sense can strongly attach to emotions and memories. Your amygdala also connects to brain areas that process vision and hearing. The amygdala is what tells a person to look up when they sense something occurring. The prefrontal cortex, where Broca's area resides, will evaluate the environment and situation for threats. If there are no threats and the situation is harmless, then this will switch off the amygdala. However, should there be a real threat, usually to life, such as someone about to be attacked or getting attacked, then the amygdala will activate the hippocampus, leading to an active response or a passive response. The moment the hippocampus responds, large areas of the prefrontal cortex shut down. The brain stem, this is the old brain, is activated when we experience a traumatic event or when we remember a traumatic event. To note in brief, if the flight or fight response is activated, a person either fights or takes flight. Then they will likely disperse the adrenaline in their body caused by the activation of their hippocampus. A person may shake or tremble as they discharge this energy and move away from a hypervigilant state to one of a more relaxed state as the autonomic nervous system calms down. If the passive response is activated, a person freezes, fawns, or dissociates. This is due to the autonomic nervous system experiencing something so overwhelming that it decides to freeze, fawn, or dissociate. For example, an attack on a person who cannot fight or escape will likely go into the freeze, fawn, or dissociative state. This is a natural response which is not something a person can control, though it is the body's way of protecting them from something so painful and unbearable. It can also lessen any pain being endured. Dissociation is where a person feels like they are having an out-of-body experience and cannot speak, move, or defend themselves. Animals in this situation, if they are not eaten or killed, will shake afterwards. This moves the animal from a passive response to the active fight or flight response to disperse the energy. Once the animal becomes aware that they are safe from harm, they will move into a more relaxed state, and the amygdala will then switch off. However, humans have far more difficulty in moving from the freeze and dissociated state, as they tend to stop the shaking if this was to occur. Usually, this is because they do not understand its reason and tries to pull themselves together. So because a person will not have dispersed this energy of the event, their nervous system becomes dysregulated. And because of this can result in them having PTSD. Of note, PTSD also often occurs quite prominently if a person has had an accident where they have had to be anaesthetized and/or had surgery. This is because they will not have had the option of the shaking. PTSD is a mental health condition that develops following a traumatic event characterized by intrusive thoughts about the incident, reoccurrence of distress anxiety, flashbacks, and an avoidance of similar situations. Complex post-traumatic stress disorder is a stress-related mental disorder that generally occurs in response to complex traumas, i.e., commonly prolonged or repetitive exposures to a series of traumatic events, within which individuals perceive little or no chance to escape. As mentioned, PTSD or CPTSD persons experience a variety of symptoms that continue months after the event or events. Sometimes symptoms last years. Triggers can occur any time and can be conscious or unconscious. However, the symptoms are activated by unconscious processes in the brain. For example, the amygdala, being the activator for the hippocampus, may pick up on a sound, smell, sight, or an environmental situation that is the same or like the original trauma situation. Then this will activate the hippocampus into a fight or flight response. The person has no control over the range of fear symptoms in the body, such as fear, panic, shaking, flashbacks, dissociation, or being unable to speak. Although the person orientates themselves to the environment and understands that this is not the same situation and that they are safe, they also have a bodily reaction to the memory which they cannot control and are sometimes trapped in terror. Rothschild termed this dual awareness. A top-down approach, bringing the prefrontal cortex online cognitively, is useful here to help a person to orientate themselves to their situation and surroundings, such as the therapist room, when they are experiencing this reaction. Self-talk, grounding, and looking at objects around them in their environment will assist them in understanding that they are not in imminent danger. However, although this orientation will help in the moment, the trapped memories in the amygdala and hippocampus will need to be addressed in a bottom-up approach, from the brainstem, the old brain, up to the prefrontal cortex. So with that in mind, let's have a look at this image. This is taken from Bessel van der Kolk's book, The Body Keeps the Score. I used this image to further explain what happens to the brain when a person is triggered and/or has flashbacks due to the traumatic experience from which resulted PTSD. To remind you, PTSD occurs when a person has not processed or released the trauma through active responses like fighting, taking flight, or shaking. These brain scans have been taken in an organized research facility where a person with PTSD had their brain scanned when listening to their own voice talk through a script they had wrote themselves about the trauma they had experienced. The first image shows activation in the limbic area, also called the emotional center, and where the amygdala is located. The amygdala warns us of imminent danger and will activate the stress response. The first image shows this activation even when the traumatic experience was 13 years ago. The middle image is the visual cortex, which is activated in memory recall and flashbacks. The third image, however, reveals that when there is an activation in the limbic area, the amygdala, there is a very small amount of activation in Broca's area, the cognitive left thinking part of the brain. This is where the brain speech center resides. So when a person experiences a flashback or trigger, the old survival part of the brain that comprises of the amygdala and hippocampus is hijacked and activated in flight or fight. The new thinking part of the brain switches off. This is why a person may become speechless or unable to cognitively understand or control what is happening to them. Language is switched off. Long after a threatening or traumatic incident has passed, the amygdala can remain painfully sensitive and reactive, not only to our occasional memory of that prior trauma, but to anything that even remotely resembles it, whether truly dangerous or not. The hippocampus is responsible for not only the fight or flight response, but also for memory, long or short term, and learning. It is also responsible for spatial navigation. It encodes and stores new memories, as well as retrieving and consolidating old memories. Research has found that high levels of stress, such as a traumatic event and the aftermath, can interfere with the hippocampus's normal everyday functioning. The ability to encode and consolidate memories can become impaired. This can further result in fragmented or incomplete memories of traumatic events, and so this impairment will hinder a person's ability to process the traumatic memories and move on from them. Research also shows that for those living with trauma, the prefrontal cortex is less active and is suppressed, making new information that could help a person to control their fear difficult. Combined with an overactive, sensitive amygdala and a less active hippocampus, which struggles to distinguish between past and present and has incomplete or fragmented memories, the prefrontal cortex will have a harder time overriding the fight, flight, or freeze response. Additionally, as the nervous system is constantly in overdrive due to the PTSD, a person's tolerance level of stress is much less. A person may also find that they have a lack of motivation and can feel depleted due to the brain using so much energy to protect them from perceived threats. Experiences can be stored in the brain either implicitly or explicitly. Explicit memory relates to conscious thoughts, words, actions, and facts, and is associated with the left hemisphere of the brain. Implicit memory is generally unconscious, bypassing language and consciousness, and is associated with the right brain hemisphere. With this in mind, if we consider Bessel van der Kolk's brain scans of someone reliving their traumatic experience, it showed the left side of the brain with decreased activity and the right side with heightened activity. Therefore, it could be pertinent to consider that when a person experiences trauma or when they have PTSD, events are stored mostly implicitly in the unconscious, nonverbal domain, which could be why talking therapies tend to be less helpful in treating a person with trauma. Because the trauma is activating the nonverbal reptilian part of the brain and deactivating parts of the new brain linked to consciousness, logic, and language cognition, much of a person's trauma cannot be put into cognitive words. The trauma is locked into parts of the brain which language, verbal language, and logic, thought cannot access. Quite often in therapy, when a person that has experienced trauma in their life, their mind will go blank when asked to think about aspects of the trauma, or they will struggle to put into words or speak about it how they feel. It has also been noted that developmentally, the left-thinking explicit brain is not receptive until late into a child's second year of life, and so early attachment experiences are reflected and stored in the implicit right brain structures. Additionally, of interest is that developmental trauma, PTSD, and traumatic memory are more easily recorded in the implicit memory regardless of age. This mechanism initially serves to protect a person from becoming overwhelmed and unable to function. However, when implicit unconscious memory is not linked to explicit conscious verbal memory, this can become troublesome for a person and can create unconscious behavioral issues such as mental illness like eating disorders. If left without any intervention, the missing integration of implicit and explicit memory may therefore create disruptions in a person's development, self-regulation, and human interactions. And this is likely to be perpetuated throughout a person's lifespan. Art making offers a way of expressing non-verbal or traumatic memories because the process of art making uses the same part of the brain that has stored these unconscious memories, the right side. Memories as such can therefore be accessed and expressed through the artwork. Through reflecting on the art together, process and product, the art therapist assists the client in gaining mentalization abilities. This is via the therapeutic relationship and the art making process. With the attuned presence of an art therapist, a client can reflect on what they have said, the processes and the products made, and see some significance within it for them, and then be able to verbalize their internal feelings and emotions. This process can help a person link the implicit unconscious memory to explicit conscious memory and can be a pathway to improved behaviours and mental health. Before we move on to art therapy techniques for trauma, it is important just to explain what EMDR and AIP are. Eye movement desensitization and reprocessing, EMDR, is a type of psychotherapy designed to help people heal from the symptoms and emotional distress resulting from traumatic memories. It was developed by Francine Chapriot in 1987 and is particularly known for its effectiveness in treating PTSD. EMDR is based on the Adaptive Information Processing AIP model, which suggests that the brain's natural information processing system can become blocked by traumatic events. EMDR aims to unblock this system, enabling the brain to heal similarly to how the body heals from physical wounds. The Adaptive Information Processing model is a theoretical foundation for EMDR. Developed by Dr. Francine Chapriot, it explains how unhealed traumatic memories are stored in the brain and lead to maladaptive responses. The AIP model guides all aspects of the EMDR treatment. It hypothesizes that maladaptively stored memories of trauma create obstacles to rational processing of information in the prefrontal cortex area of the brain. When working appropriately, the innate information processing system metabolizes or digests new experiences. Incoming sensory perceptions are integrated and connected to related information that is already stored in memory networks, allowing us to make sense of our experience. What is useful is learned, stored in memory networks with appropriate emotions, and made available to guide the person in the future. Problems arise when an experience is inadequately processed. For example, when someone experiences a trauma and they experience overwhelm, as I mentioned earlier. The AIP model suggests that a particularly distressing incident may become stored in state form, meaning frozen in time in its own neural network, unable to connect with other memory networks that hold adaptive information. It hypothesizes that when a memory is encoded in distressing form, the original perceptions can continue to be triggered by a variety of internal and external stimuli, resulting in inappropriate emotional, cognitive, and behavioral reactions, as well as overt symptoms such as high anxiety, nightmares, intrusive thoughts. Dysfunctionally stored memories are understood to lay the foundation for future maladaptive responses, because perceptions of current situations are automatically linked with associated memory networks. Childhood events may also become encoded with survival mechanisms and include feelings of anger that are inappropriate for adults. However, these past events retain their power because they have not been appropriately assimilated over time into adaptive networks. The AIP model views negative behaviors and personality characteristics as the result of dysfunctionality held information. From this perspective, a negative self-belief such as "I am not good enough" is not seen as the cause of present dysfunction. It is understood to be a symptom of the unprocessed earlier life experiences that contain the effect and perspective. Attitudes, emotions, and sensations are not considered simple reactions to a past event. They are seen as manifestations of the psychologically stored perceptions stored in memory and the reactions to them. During EMDR therapy, a person recalls distressing experiences while focusing on external stimulus, such as side-to-side eye movements, hand tapping, or audio stimulation. This process is believed to help the brain reprocess traumatic memories, reducing their emotional impact and allowing for healthier cognitive and emotional responses. The goal is to add adaptive emotions to the neural network. This is obtained through bilateral stimulation, a process that creates new neural pathways and the ability to access the stored trauma. This allows for the reprocessing of the trauma and a reduction of associated anxiety, thereby creating new associations with memories and increasing adaptive behaviors. So keeping in mind the earlier information about what happens when we experience trauma and the effects on the brain, on the amygdala, the hippocampus and the prefrontal cortex, we now explore bilateral drawings. You may want to revisit but the earlier slides just to recap on all that information. But bilateral drawings here are based on the principles of AIP and EMDR. So art therapy works both verbal and non-verbal in the processes. It is also a method to release internal feelings and emotions and make them external. Art therapy helps a person to express how they are feeling when they cannot put this into words. They can see externally how they are feeling and explore and process these at a safe distance. Bilateral drawing is a fascinating process. It is a technique that involves using both hands simultaneously to create spontaneous drawings. This method engages both hemispheres of the brain, which can help in self-regulation and trauma recovery. The process is often referred to as scribbling with both hands and doesn't focus on creating a certain image but rather on the act of drawing itself. This can help individuals ground themselves, reduce stress, and reconnect their explicit and implicit memories. There are various bilateral drawing techniques that can be used. However, for this technique, we keep the AIP and the EMDR models in mind. In this video clip shown, you can see that a piece of A3 paper has been folded in half. I asked the child to draw something on both sides, not using both hands to draw at the same time, but to swap the pen between the hands and to draw something on each side. I would ask the child or the young person, or this can be done with adults, to think of an event or situation that they have been most upset about. I would then ask the child on a scale of 0 to 10 how activating it was. i.e. triggering or upsetting. For example, 8 or 9. Then the child or young person, or again an adult can do this, would focus on the event or situation as they drew, moving the pen between both hands. Depending on time, I would usually ask them to do this for 10 to 20 minutes and mention that they can talk or not talk as they do it. However, ideally this is done in silence until the time is up so that they can keep focused and allow the processing to occur. At the end of the session, I would ask them to rate how they felt now, and they might say 2 or 3, for example. This indicates that they have been processing the event or memory and the impact of it has lessened. Ideally, the activation when thinking of the event of situation comes down to a 0 or 1. However, this can be further worked on again in future sessions to lower it further. The reason for swapping the pen between the hands is to stimulate a similar response that EMDR might hope for. That is to link both the right and the left sides of the brain, the unconscious nonverbal memories to the conscious cognitive verbal memory. As mentioned earlier, when implicit unconscious memory is not linked to explicit conscious verbal memory, this can become troublesome for a person and can create unconscious behavioral issues and mental illnesses. Bilateral drawing in the way that the video has shown can help make this link so that the person has both a conscious and unconscious processing of the upsetting traumatic experience or experiences, so that this does not impact them and cause further issues such as anxiety, panic, insomnia, mental health issues, and or through negative behaviors. Sometimes after doing the previous exercise and or as a suggestion to clients wanting to feel calm, I introduce the client to another bilateral exercise, drawing the infinity symbol while swapping the pen again between both hands. The focus is on the flow of the pen and could be felt like a gentle rocking from side to side, similar to like a baby being gently swayed by their mother or carer to calm them down. Clients with anxiety or stress, and for those that have experienced trauma, have fed back that they feel more relaxed and more in control of their emotions, which is helping the children or young person, and again adults, to feel more grounded, regulated and calm. Students often need experiences that involve movement to reduce sensations of feeling trapped, withdrawn or out of control. Drawing bilaterally shifts attention away from the distressing situation to a more action-orientated, self-empowered focus, which can alter one's internal rhythms for self-regulation and well-being. So the size of any of the bilateral drawings can be on any size paper. You will notice a client may do small movements or large movements. There is no right or wrong way. The main thing is that they're swapping the pen from side to side and focusing on that event. And you are there to monitor and, if needed, help regulate them so that they're not getting overly overwhelmed. But You can use any size paper and the movements can be as big or as small as the client wants. Other than the two methods of bilateral drawing that I have shown you, bilateral drawing can be done in various ways and have different therapeutic outcomes. Lines can be drawn by passing the pen left to right and back again constantly, stimulating the EMDR response, or they can be done with the pen in both hands moving at the same time. You can also explore different mark making. For example, curved lines, lines that join at the bottom, circles on each side, lines across the center, and or swirls over the center line. Bilateral stimulation can be a powerful tool in trauma recovery. By engaging both hemispheres of the brain, it can help regulate and integrate emotional and cognitive processing. This integration can facilitate the reconnection of explicit conscious memories with implicit unconscious memories, potentially leading to a more comprehensive healing process for trauma survivors. Art therapy, in particular bilateral drawing, is a fascinating approach. It involves drawing with both hands in turn as shown previously, or by using both hands at the same time to draw. This can promote a sense of balance and grounding. This method can help regulate the nervous system and reduce the freeze response, a common reaction in individuals who have experienced trauma. These techniques are often used in therapeutic practices. It's amazing how engaging the body and mind together can promote healing and recovery. So to recap, bilateral drawing is a compelling practice for self-regulation. By using both hands to draw, it engages both hemispheres of the brain. Here's how it can help. Grounding. The physical act of drawing with both hands can create a sense of presence and mindfulness, helping individuals stay grounded in the present moment. Balancing activation. Activating both hemispheres of the brain can promote a sense of balance and harmony within the nervous system. This can help regulate emotional responses and reduce feelings of overwhelm. Reducing the freeze response. Engaging both hands in a creative process can interrupt the freeze response often associated with trauma. This can help individuals move from a state of immobility to one of activity and engagement. By involving both sides of the brain, bilateral drawing can facilitate the integration of cognitive and emotional processing. This can help individuals process and make sense of their experiences more effectively. Art therapy in general provides a safe outlet for expressing emotions and experiences that might be difficult to verbalize. Bilateral drawing can enhance this by incorporating a rhythm and a meditative component. So some further reading. The Body Keeps Score. Trauma-informed practices with children and adolescents. Trauma healing with guided drawing. A sensorimotor art therapy approach to bilateral body mapping. Thank you for listening to this presentation. I hope you didn't find it too long. I hope you got some important information. Neuroscience, as mentioned, is very complex, as is trauma at times. But this was kind of an overview aimed to put in simple words to show you how bilateral drawing can help and why it can help a person process and heal from trauma. Thank you for listening.